All right, so today we are going to be teaching Danielle how to perform CPR on someone without an AED. So the first thing you have to do is to check the scene around to make sure that the scene is safe. That's really important because you have to have your own safety and then the safety of the other person.
Next, check on the person. Tap the person on the shoulder and shout, "Are you okay?" to ensure that the person needs help.
Are you okay?
Are you okay?
Perfect. So after that, you should be calling 911. If it's immediate that the person needs help, you can have somebody else call 911. If not, then you can call 911 yourself.
Next, you're going to open the airway with the person lying on his or her back. Tilt the head back slightly to lift the chin.
All right, now you can give it a try. Great job. So the next thing we're going to do is we're going to be listening for breathing. So you can listen, put your ear to their face or face area and listen carefully. If you don't hear anything for any more than 10 seconds, then there's no breathing and we can perform CPR. If there is occasional choppy sounding breaths, that does not count as breathing and you should still perform CPR. So you can give a listen to their breath sounds. You hear anything?
Nope.
Oh no.
So once you begin CPR, you're going to place your hands one on top of the other in the middle of the chest. Use your body weight to help you administer compressions that are at least 2 inches deep and delivered at a rate at least 100 compressions per minute.
I'm gonna push down. Give it a try. Awesome. Great job having your hands over one another.
Thanks.
So you're gonna push down hard and fast for 30 compressions. After 30 compressions, you're gonna be starting rescue breaths.
You're going to apply the pocket safety mask to the face of the patient.
Perfect. After you apply it, you're going to tilt the head back. You're going to pinch down on their nose, and you're going to apply 2 breaths deep, so you have a full mouth connection so they can get the same breaths. So give it a try.
You are to make sure the chest of the person rises.
Awesome. So if the chest does not rise with the initial breaths, you can re-tilt the head back for the second breath. And if the chest is still not rising, you should be checking the airway to make sure that there's nothing inside. If you see something and they are choking, you can just insert one finger and just swipe through to remove anything that's inside.
After each set of 30 chest compressions and before attempting breaths, look for an object and if seen, remove it.
Just like we said. And then if everything's going well and you see that their breaths and their chest is rising, continue giving 30 compressions and 2 breaths until an emergency responder arrives or you become exhausted, so you need somebody else to do it. So how about you give it a try from the beginning? So start off with those 30 compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Put that chin back. Awesome, very good. So next time when you're giving compressions, try to keep your hands remaining on the patient the entire time instead of lifting up. So it's just pressing hard and deep all the way down without having to raise your hands up.
Got it.
So you want to try it one more time?
Sure.
Awesome, great job.